Good afternoon and welcome to the Multicultural Media Online Conference. I'm Jesusa, Helaratne, Deputy Director of the Multicultural Health Communication Service, and I am your moderator for today. And this session is hosted by the Multicultural Health Communication Service, the Ministry of Health, with the support of Multicultural New South Wales. And I am so pleased to let you know that we have two special guests today. We have with us Petra Milnes, General Manager of Delivery and Engagement of healthdirect Australia, and our regular special guest, of course, Dr. Jan Fizzell, Senior Medical Advisor from New South Wales Health. Petra and Dr. Jan, thank you for joining us. Today, we're going to be talking about healthdirect and how important this service is. But before we start, we'd like to begin by acknowledging the traditional owners of the land from which we are all meeting from today. We pay respects to elders, present, past, and emerging, and extend that respect to all the communities or Aboriginal colleagues who may be joining us, and also for multicultural and refugee communities that are represented in this session. We are joining you from the land of the Camaragal people of the Eora Nation. With an increase of winter illnesses expected over the coming months, and it is winter, you can feel it, heavy jackets on, fashionable, yes, but very cold. And people across New South Wales are being reminded of the free and instant health advice and treatment that's available 24/7 by calling healthdirect. And that's the number we'll tell you, 1-800 022 222. But I guess, Petra, and we're here to encourage the New South Wales residents that this number is available, especially during this time. And apparently, last winter, nearly 20,000 people across New South Wales called healthdirect. What is healthdirect?
Thanks. So healthdirect provides, it's a national service. We provide free information, advice and connection to care 24/7, no matter where you are in Australia. So if you're in New South Wales, if you're in South Australia, Tasmania, you can access the service. We have two different channels. We have the helpline, which rightly stated, the number is 1-800 022 222. And we also then have our website, which has lots of advice and digital tools like the symptom checker and the service finder that can connect you to care. So the helpline is actually staffed by registered nurses, so you can call them anytime.
So Petra, this is a great line, and I think we'll talk about how you access it. But Dr. Jan, why call healthdirect? And I know Dr. Carrie Chant has also used this line before, and she mentioned it in one of our sessions. But it really is important to note that you can actually speak to a clinician.
That's right. And I think a lot of us have situations where we don't have a life-threatening emergency, but we do want to know, what do I need to do right now? And it's not uncommon to have a sick kid at home and not to be sure, do I need to take them to the hospital? Don't I need to take them to the hospital? Or maybe they've injured them, partner's fallen off a ladder and injured themselves. They're up and they're walking about, but they've still got a really sore arm. Do I need to take them to hospital, or is there something else that we could do? Or maybe you're away from home and something's going on. Maybe you've just run out of your medicines, or maybe something else is happening and you're not sure what services are available locally. And that's where healthdirect can really help plug a gap for us, if you like. It's amazing at 2 o'clock in the morning, you've got a kid and you're just not sure, do I have to take them out, particularly in the cold weather, or can we manage this at home? And by it being a doorway to so many of the services, both GP services, but also our doorway to virtual kids, which is a virtual emergency department, a doorway in some areas to virtual adults, and emergency care for adults. You can actually not just have the registered nurse on the end of the phone, but healthdirect in appropriate circumstances can help connect you to GP care and emergency care as well. So it's an amazing service, and we're just so lucky in New South Wales to have healthdirect available to us.
Thank you, Dr. Jan. And I think the question is, when we're targeting multicultural communities, and a lot of the media, multicultural media, and some of the health workers and community leaders are watching this session, if you don't speak a language, if you don't speak English and you speak another language, how can you access healthdirect? There is the health interpreting line, which is TIS, but I think there's something new that's really good to hear about healthdirect right now.
So there's the translation and interpreting service, so TIS. So you can either call them directly and they can transfer you to Health Direct, or you can call Health Direct directly, and they can conference call you with a TIS interpreter. And I think TIS offers something like 120 languages. We also have on our digital channels, there's a number of resources. So the service finder is translated into something like 16 languages, and then there's other resources that are available. So if you're not familiar with the health system, it can tell you, how the health system works. And I think those resources are available in about 12 languages or something like that. So.
Well, thank you, Petra. And those resources are available in New South Wales Health, and some links are going to be there on the chat, and we'll send those through to you later on. But I guess the question is, what is the cost of calling Health Direct? And some people might think there's a cost to it, it's expensive.
It's actually free. So it's free to access any time of the day, even if you call in the middle of the night. And to Jan's point, something like 2/3 of our callers are actually, they call in the after hours when, you're really not sure what to do. Your GP's closed, your pharmacy's closed, so you can call us, and then the nurse will ask you a series of questions. And then depending on your answers, it may be, you need to actually go to the emergency department, but as New South Wales has added new pathways like urgent care centres, virtual kids, virtual adults, depending on the time of day, or the GP helpline, pharmacies even. So the nurse can direct you to any one of those different pathways, but sometimes it might actually be more suitable for you to care for your loved one or care for yourself at home, and they can provide you with information on how to do that as well.
And I guess you really want to know if by calling Health Direct, and I think this is where it really is crucial to know that this service is so important, because if you don't know that you need to go to the emergency or just need to, this is the service to call.
That's right. Yep. And you can call us, but again, if you have a computer and you feel like you're able to, you can go onto the website. You could also ask a loved one to go onto the website or to call us on your behalf. So quite often we find that the highest users of our service are actually parents, or sometimes they're people calling on behalf of their partner or a loved one, an elderly person. People call themselves, but the highest percentage of users are actually usually parents.
And Dr. Jan, in family is so important, and sometimes you don't feel comfortable in calling the number, and that's where the support you have is really important for them to know this number.
And that's it. It's about sometimes you'll be the one in the family that people will be calling and saying, should we do something? And if you can be there with the person who's unwell or has been injured and call Health Direct, you can be an interface for them with the service so that people are able to understand what's being happened, understand what's being recommended. And because we do have all these different services available, people can be confident they're not just ringing a switchboard, they're actually ringing health professionals who can give them good healthcare advice. And also tell them, these are the things that I need you to watch for, and if these things change, to get back in touch or to proceed to hospital. And I think that's also really good advice that a lot of us just want. We just want that reassurance. Often, am I doing the right thing? Am I doing enough? And if it saves, schlepping out of the house at 2 o'clock in the morning with a sick kid, that's just an amazing thing. And the feedback I've had from my friends that, they've sort of said, oh, do I or don't I? I say, well, ring Health Direct. They're the ones who can help you. And they've really made a huge difference to reassuring those people that things are okay, or actually saying, no, I really do think you need to go and see someone. And that way they've got that confidence behind them that, yes, it is worth getting us all out of bed and go off to the hospital we go.
What are the common types of health issues that people call Health Direct for?
It's a really good question. So last year, our sort of evidence showed that people called for fatigue, fever, cough, headaches, runny nose, vomiting, diminished appetite, nausea, abdominal pain, and sore throat. So, and it seems like very much at the moment we're heading into flu, like cold and flu season. So, we can see those similar symptoms trending as well on both like our digital channels and on the helpline.
But I think the thing is that Health Direct can also help with, minor injuries to sort of help you understand, do I need to go and see someone at a hospital, or can I be referred to urgent care, or do I not need to you know, can I look after this for myself at home? You know, I think a couple of weeks ago we were talking about burns, and that's a good example of, you know, depending on the type of burn injury you might have, there'll be different level of care recommended for you. And those registered nurses are able to make that assessment by using those.
Got a clinical decision support tool that supports the registered nurses on the helpline. It also powers our symptom checker online.
Exactly.
So I guess the question is, you know, we've always talked about urgent care, emergency care. This is where you get the right advice.
That's right. So I can actually vouch for that firsthand. 2 weeks ago, I was very unwell and was sick on the Sunday, woke up on the Monday with a very swollen face and lips. Didn't really know what to do because I had an appointment with my GP, but for the following day, but my lips were swelling so severely that I was like, this could be an issue. So I called healthdirect. The nurse took me through a series of questions, asked me about my symptoms, and then said to me, you know, I actually think you need to see a GP in 2 hours. I had an appointment, but it was for the following day. So I said, I can't get to the GP. So she said, well, can you get to an urgent care centre? So she looked up the urgent care centre in my area, made the appointment for me. And then, you know, within, I think 40 minutes, I was sitting in front of a GP at the urgent care centre being assessed.
Wow.
Yeah, and I think it's a huge difference now because we've got that many different ways we can look after people. And I know a lot of people do have trouble, you know, if you aren't at your GP's office at, you know, 7 o'clock in the morning, there's no way you can see GPs in that office today because the demand is so great. And that's where the urgent care centres help. And I think that's what's really helpful with healthdirect is they can help you understand, do I even need to queue up at 7 o'clock in the morning to see my GP? So I think it's really helpful. The other key thing is now that we're coming into COVID season, again, for people who are immunosuppressed, people who are older, people who may need treatment for COVID. Again, healthdirect is very good at linking you up with people who can help provide that care. If you don't have a plan with your GP already, make a plan with your GP already. But if you don't have that plan, you know, talking to healthdirect when you're in that circumstance can be really helpful.
Yeah, that's right. So we, in addition to the advice that we provide and the connection to care, it can also be, you know, if you're traveling somewhere or you just don't know what services are available, the nurse on the helpline can look up those services for you and tell you what's nearby. Or if you go to our website, you know, if you're able to, then also we have the service finder and you can search for services on there as well.
So I'm guessing, for example, you don't have a computer, you don't have a phone, and you only have access to healthdirect. They can actually provide you all that information.
Yes.
Wow.
Yeah. So if you're having trouble searching or anything else, healthdirect can help you talk through it. And one of the other things healthdirect is doing now is listing the pharmacies that are got the enhanced services in New South Wales. So if you're a female who's got a urinary tract infection and it's not complicated, healthdirect can help guide you to a pharmacy that's offering the UTI service, because the pharmacy should be registered with healthdirect. For oral contraceptive pill resupply, it's getting listed on healthdirect, and as the expanded services in pharmacy become more available, those two will be, pharmacies will be able to list what services they're offering. And you'll be able to find out that this local pharmacy does offer, you know, a particular service, particularly if you're in a country town and you find you've got a urinary tract infection. Often the pharmacy is open and available and will save you a trip to the hospital and leave the emergency department for emergencies.
Wow, it's a great service. I mean, you can ask, it is anything. So, you know, I guess the question is, can I call for anything relating to health that I'm worried about?
So, yes, the answer is yes. You know, we do say, and I think Jan will back me up here, if, you know, if it's an emergency, the best thing to do is call 000. But if you're unsure, then, you know, you can call healthdirect, and the nurses can actually call 000 on your behalf, and, you know, and can make that assessment for you if you're unsure and connect you to the right care.
And it goes the other way too, I think, doesn't it? So if you've rung 000 and the triage people from ambulance believe that healthdirect might be a better solution for you, they'll help navigate you through to healthdirect. So it's a two-way street. If if the health direct nurse believes that you need an ambulance for the symptoms you're describing because you didn't realise that the pain down your left arm and up into your jaw was an emergency, the nurse there can connect you to an ambulance. And again, if you ring the ambulance service and you don't need an ambulance because it's something that could be managed safely with another service, they can connect you through to Health Direct.
So that's really important because, when you get sick, and this applies to all of us, we are in the health system and then we get sick and we just go, well, what do I do?
And I think the really important thing is it's not less. Some people think that if they're not talking to a doctor or if they're not talking to the ambulance, that they're getting less. But they're not getting less, they're getting what's right.
Right, that's right.
And so the most important thing we can ever do for anyone is give them the right care in the right place at the right time. And for so many of us, the right care is getting really good advice at home, how to manage ourselves, and to understand when we might need to go and seek additional help or when to check in again if we're not sure that things are going right. So, the right care is not necessarily heading off to the hospital emergency department because they're busy, they're loud, they're really important if you've got an emergency, but if you can be looked after either at home, through a virtual care service or through an urgent care clinic, it's so much better than needing to be at that emergency department.
If you have any questions, please put them in the chat and we can have Petra and Dr. Jan to answer these questions. It is a wonderful service. Even Minister Park, Health Minister Park had mentioned that he uses virtual kids, so for his kids, and that was even last year he mentioned. So it is an important service. Now, I wanted to ask, a lot of communities, especially those who may have arrived just recently and some communities that may not have access to digital or support, how do we make sure, and how does Health Direct ensure that the messages are being delivered or we're able to access these communities?
Good question. So we, last year we developed what we call a consumer experience strategy. So we're increasingly working with consumer groups and other key groups to get the message out there. It's also really important that, our state colleagues such as New South Wales Health and in other states, SA Health or whatever, work with us to help distribute that message amongst their communities. So I think it takes, community engagement, which we're committed to, but working with state health departments to get the message out there. And a lot of it is word of mouth. But, we know that in some areas in particular, awareness of Health Direct could be higher. So we're really keen to work with community groups to get the message out there. So, we're keen to engage with you if you're a community leader. If you need information, please contact us. We've got resources available through our communications team on the website, but we're also interested to look at other ways that we can work with community groups to get the message out there.
And I wanted to ask this because some people, if they are not digitally literate, and I think this is where everything is so important now. You may have a phone and it's being shared by families or family members and you don't have access. I guess that's where, how do we ensure that there is that information being shared across?
So I think I'm going to try to answer the question directly, if happy for you to ask me a follow-up question. But so it's really, we know that in some communities, for example, people may share a phone between family members. So people can call Health Direct on behalf of someone else, like Jan said. So, like if you've got an elderly parent that doesn't speak English and your parent is comfortable for you to do so, you can call them on you can call us on their behalf. And go through the symptom checker with the nurse, who will then direct, your loved one to appropriate care. The other way is, you can call the translation service the TIS, as we've spoken about, or, you could also have someone go online for you and access the information for you and go through the symptom checker for you.
And I think that's really important to know, because a lot of people, in some cases before, no, you have to call.
Yeah.
You're the one who have to give the information, and we get that in when we're calling for our bank details. But this one, at least, we can say, look, you can actually call for someone.
And I think that's particularly important, again, because it's a service where parents might be calling on behalf of their child, and it may be a service where a child is calling on behalf of a parent, or it can be even a young person calling on behalf of an older person because the young person's worried that mum isn't quite right. Now, hopefully that person's called 000 if mum's not capable of calling 000, because generally speaking, if mum's that sick, we probably need 000. But it's another area where, you know, an older teenager, for example, can help their family access care. And it's really important, though, that we look after people, and the fact that it's free makes a huge difference. You know, you can call and ask for advice and it's free, which is fantastic. It really removes one of those barriers to people seeking care.
Another important thing about it being free is that you actually don't need a Medicare card to access the service, and I think that's really important. So, you know, if you don't have a Medicare card, if you're new to Australia, you can still call the service and get access to care. Now, some of the pathways may require a Medicare card, so if you don't have one, you can talk to the nurse about that, and then they'll direct you to the most appropriate care pathway.
That's great. Now, it's important that, you know, some people receive health advice and assistance that is culturally appropriate, and that's what, you know, we do to ensure that we're addressing the needs of culturally and linguistically diverse communities. If people do call healthdirect, are they able to provide assistance that meet the requirements of cultural and religious beliefs?
Yeah, so if they call healthdirect and they speak to the nurse and let the nurse know, you know, what their cultural beliefs are, the nurse can work with them to make sure that they're directed to the most appropriate care.
That's really good.
Yeah, and I think it can be really hard because I know some, you know, women prefer to see a woman doctor, some men prefer to see a male doctor. We can't always meet that need, no matter how hard we try. But I think it's really important that people understand that in Australia particularly, you know, across the world, different health professionals have got very different roles and different amounts of training. But when we say you're talking to a registered nurse in Australia, you're talking to a highly trained professional who's working in a great system, which has got a lot of oversight by doctors and nurses together to try and make sure that people get good and safe outcomes, and that you get referred to the area where you need to be and you need to have that care. So it, you know, I've often, when talking to different community members, we only want to talk to the doctor. But here in Australia, where, you know, the nurses are so highly trained and so well educated, talking to a well-educated, trained, registered nurse can sometimes be better than talking to a doctor like me who doesn't practice clinically anymore.
And that's right. I think people, it's good to have this conversation knowing that, look, I don't need a Medicare and I shouldn't be afraid to call, because a lot of people are afraid to call. And we remember that during the COVID times when, what do I call? Am I able to access this?
And I think that's the really important thing about healthdirect. They're actually there to help you, to reassure you as well. And I think it's something like 2/3 of people don't need to go and see an.
That's right. Something like 2/3 of people are actually referred to other care pathways, not to the emergency department. And we know that it's something like 55, when we've asked after people have used our service, you know, what were you initially intending to do? Something like 55% of people said, I was going to go to ED. And then we find out that, you know, most of them were actually redirected to different care pathways that were more appropriate for the conditions that they had.
And that's got to be much better for you if you're not winding up in an emergency department when you don't need to be. If you need to be in an emergency department, that's the best place for you. But if you don't need to be in an emergency department, it's so nice to not have to go. I think most of us have had that time of sitting and waiting, or being the relative sitting and waiting. And I think it's really great that if you don't need to do that, you know, isn't it good?
And I'm just thinking about university students, international students who are just come here for a period of time, universities, understanding, look, you can't call, you don't, it's free.
Free. You can actually, it's free, and you can actually call anonymously. I mean, there may be times when, so for example, if the nurse needs to make a booking for you for an urgent care centre, you know, they will need your name and you will need to identify yourself, but you can call anonymously to ask for advice, you know, and if it gets to a point where they need to identify you, then they will. But I think that's great that it's a free service. You don't need a Medicare card, and, you know, you can call anonymously. So if if you're concerned about something that's a bit embarrassing, you can call the nurse and she'll give you some advice.
Another question came up in my head, and I think one of the things that sometimes you wonder if you're calling for someone, then, and I think key information that you may need, what medicine you're using, is that something that you should be careful?
I think that's why it's good to call with the person
Present
with you.
next to you. So when I've called in the past, so once I've called on behalf of my daughter when she was little, but also I've called on behalf of my elderly mother, and sometimes I'll say, you know, is your mum sitting next to you, or can you ask your mum, or can you ask the person, you know, what medication are they on? And you know, definitely when I had firsthand experience a week or 2 weeks ago, they asked me about my medication, and my, you know, do you have any other symptoms, or do you have any sort of health history that we need to know about? So.
And I think that's where it's helpful, because sometimes you won't know that mum's medication changed last week, and it could be that it just changes. As we've talked about, the nurses work through, you know, what could put you at higher risk. It might make you need to go to emergency. So, for example, you know, if you're on medicine that thins your blood, for example, and you've had a fall and you're bleeding a lot, you know, you may need to go and seek emergency care, so that they can think about whether you need to have something done more than just stitching up the wound, for example. So it's really important that you've got a good understanding of what the person's health history is as best you can, or that they're willing to talk with you there, frankly, if you're the interpreter. Otherwise, using the telephone interpreter service so that person can have a private conversation will also lead to a better outcome.
I think this session has been really great, because we understand, we know, okay, there's healthdirect, but understanding what you can do and what you know, that's, you don't have to be afraid to call the number if there's a need to. And I really appreciate the time that you've given us, Petra. Thank you for giving that information, and also Dr. Jan. But any last words? What is the number for healthdirect, and how can you access the TIS line as well? Okay,
so the number for healthdirect is 1-800-022-222, so 1-800-022-222, and the TIS line is 131450.
Thank you so much, Petra, for being here. And Dr. Jan, any last words?
Oh, look, if you've got any queries, call healthdirect. They can help you find the appropriate level of care, so that, you know, if there's something embarrassing or that you're concerned about, do ring and do get help, because much better to know than not know.
Oh, well, we have one last question. Could we? I think we have a bit of time. A friend of mine thought that healthdirect is a free doctor who comes directly to your house, like Uber, but for GPs. What do you think of that perception?
Oh, isn't that lovely? Look, there are definitely doctor services that will come to your house, but this is even better to some extent, because you don't need to have the doctor come to your house. You can actually get that advice while you're at home, comfortable and everything else. And if you do need virtual care for your kids, it will come in. If you need a telehealth appointment with a GP, they can help set that up. And if you do need to leave the house and go and see a doctor, it's there too.
Yes, I was going to say a similar thing, maybe framed a little differently. But so, you know, you call healthdirect, a nurse triages you to the most appropriate care pathway. Quite often, if that's in the after hours, or if you can't get to see your own GP, say if you need to see a GP in 2 or 24 hours, they'll either direct you to virtual kids, virtual adults, or to the virtual GP service if you're eligible. And then if you see that virtual GP, you know, that GP will then try to send a summary back to your normal GP via My Health Record, which is really important for that continuity of care.
Well, thank you so much, Dr. Jen and Petra, for being here today. And I hope you learned more about HealthDirect. And if you have any questions, please let us know. And if you have any great stories that you'd like to share as testimonials as well, that would be great. But thank you for joining us today. Hope you've learned so much. And thank you. And we hope to see you again in the next fortnight. But meantime, if you have anything to ask about your health, you can call HealthDirect. Take care and stay safe.